18 years now along with our family. So there's a very personal piece to this. When I was first submerged into the mental health system, it was when my son was arrested, taken to the hospital in handcuffs, and I met him there. And he looked at me and he said, "Mom, you can't leave me here." I said, "I don't know how I can leave you here." I knew through the next few years of struggle with Nathan that my grief was overwhelming. I knew if I let myself fall into self-pity, that self-pity would be like a noose hanging over a rafter. I could hang myself on it, never make any change, never move on, and dissolve into my grief. But that's not who I am. And I knew, and I thought about Martin Luther King's talk about our network of mutuality and how all the threads in the tapestry of the human existence are affected by what happens to one thread in that tapestry. I knew I wasn't the only mom who was suffering. Then came my alliance with NAMI Lexington. It literally saved my life. I want to thank my board, my team, because no one person can ever do this. And I met my mentor, Mr. Joe Toy, whom I demanded to see and asked him about what the hell's going on with this 200-year-old hospital and why are we putting up with this? And he said, because that's what we're expected to put up with. He said, I've spent my life trying to prove to people in mental health that we don't have to settle for this, but I'm going to need your help. I said, sign me up. Tonight is evidence of a very public thing that's happening. The physician of the year was a psychiatrist. A psychiatrist. For a long time, psychiatry has been treated kind of like a stepchild in the medical community. There was an anti-psychiatry movement of the 60s. But now we're here to tell you that serious mental illness is like any chronic mental illness. Heart disease, cancer, diabetes, it's all the same. We need a complete and full continuum of care. Everything from community-based services and summer camps for our children. And yes, we need hospitals. There are times in the life of a cancer patient where they cannot be treated as an outpatient. They have to go where? To the hospital. There are times in my son's life that I cannot treat him in the community. He needs to be in the hospital. And I don't think that that should come as a result of dangerousness. We don't tell cancer patients to come back when the tumor is too big. Wait a little longer and we'll remove that brain tumor. Let's wait till it's dangerous. We face a lot of challenges with the mental health community, behavioral health community in Kentucky, but we are rising to meet them. I thank my mentors, I thank my team, I thank my board of directors, I thank Bluegrass Regional Mental Health, Mr. Joe Toy, Ms. Shannon Ware, and my husband. Peace.